Well, I'm pleased to see such a good turnout here this afternoon. I want to thank Latah Community Health and CHAS, the clinic administrator, Amy Isbell, I know Amy's around here in the back, and CEO Erin Wilson for their hospitality this afternoon and for this opportunity to reflect on how this vital facility and the valuable resources it offers came to be. So we're going backward a little bit here to talk about the origins of this facility. As Erin said, it's not a new concept, but the fact that we have a CHAS clinic in our community is especially noteworthy. So I want to congratulate everybody here who supported and sustained our federally qualified health center in Moscow. I'm glad to join you all in celebrating National Health Center Week and to represent the League of Women Voters Moscow at this event. I want to acknowledge some of my colleagues who are here today. So if you're a member of the League of Women Voters, wave your hand. There you go. Pretty good turnout up there today. So we were invited here today to participate because in December 2012, our league completed a study that documented local poverty, including healthcare needs, and helped justify the establishment of this facility. CHAS opened its doors at its previous location in Moscow in June of 2013. So consistent with all this road construction detour stuff around here, the road to Latah Community Health has also been long and winding, and at times a little hazy too. It probably began in November of 2010 when Steve Bonner, who some of you know is Executive Director for Sojourners Alliance, and the late Mike Bowman, who was a volunteer with the Hope Center and with St. Mary's, set up a meeting with me in City Hall when I was mayor. And Steve described his distress over having to turn away several families in a single day because of lack of space in the shelter. Mike chronicled stories about a worrisome number of people who were asking for help to pay for things like gas and utilities and medical expenses. We heard rumors about depleted shelves in area food banks and families who were struggling to patch together their lives. They had part-time minimum wage jobs and they were struggling. It didn't seem like an isolated issue that confined to just homelessness or food insecurity or to medical needs. At the same time, some people insisted that we couldn't possibly have a problem here with poverty. If it existed, it was invisible. So to test the idea, the city convened a public meeting in City Hall in December of 2010, and we invited all of the agencies, the service organizations, the public officials, healthcare providers, and citizen stakeholders, including members of the League of Women Voters, all of those people we could think of to describe their experiences with poverty. The turnout and the pent-up energy were just eye-opening. It was obvious that for all of the good work being done here piecemeal, there was a need to improve networking and collaboration among those with needs and those with the resources to address them beyond the ones that were available locally. Healthcare was a significant part of our discussion. In March 2011, the League of Women Voters Moscow embarked on a study of local poverty. That process wasn't simple. We started with a formal proposal to the membership, and that's the first step in an inclusive, deliberative, consensus-seeking process that's clearly spelled out by the National League. Once that was authorized by the members, our team conducted interviews, compiled data, and drafted chapters in each of 5 areas related to poverty: housing, food insecurity, childcare, transportation, and healthcare. And it became obvious to us that those challenges were interconnected. We found out that too many people were one health crisis away from homelessness, hunger, unemployment, and financial catastrophe. Too many took the dangerous road of foregoing preventative care, ignoring nagging symptoms until a crisis, relying on emergency rooms for everyday needs like colds and earaches or even childbirth, and expecting the existing medical model to sustainably absorb underinsured patients. Back then, the nearest health centers for sliding scale primary, dental, and behavioral health care were in Lewiston, Plummer, and Coeur d'Alene, 35 to 90 miles away, and transportation could be problematic. In 2010, before the Affordable Care Act, 11.4% of Latah County residents lacked health insurance. In 2011, Gritman Medical Center wrote off $1.2 million for people who couldn't pay for care, and by 2012 that figure increased to $1.7 million, even as our Latah County Commissioners budgeted more than $500,000 for indigent care not covered by Medicaid. In December 2011, with the League study underway and poverty forums continuing in City Hall, the League invited Marie McHugh, a nurse practitioner from CHAS in Lewiston, to tell us about the federally qualified health center model. She was part of our League of Women Voters speaker series, and she told us what that could mean for our community too. And by the way, our speaker series is going to start up again soon. If you're interested, it's Wednesdays from 12 to 1 in our 1912 Center. In August 2012, former CHAS CEO Peg Hopkins and current CEO Erin Wilson came to see me in City Hall, and we discussed local needs, potential partners, including Gritman, and the feasibility of establishing a health center here. And Peg agreed to speak and answer questions at our public forum later that month. With that background, the League's report, dated December 2012, identified the lack of a federally qualified health center as a significant deficiency here and documented the need for more licensed and certified healthcare providers statewide. After reaching consensus on recommendations, which was another step required by the League's formal process, we adopted a position statement to influence public policy and effect solutions. Among other objectives, the policy statement committed our League to encourage the development of such health facilities in our community, especially for low-income and medically underserved people, to advocate for transportation services to enable access to those facilities, and support programs that would increase the number of professionally licensed and/or certified healthcare providers. Latah Community Health fills a gap in our healthcare system. It provides a safety net for those who had none, and it offers quality medical care that anyone can afford. It has challenged and changed individuals' lives and our community for the better. This center creates good jobs, complements other medical, dental, and social services, and lessens overall costs through preventative care, timely intervention, and chronic disease management. Our League study has been posted on the National League's and cities' websites and shared as a model for a similar study in Whitman County, and supported appeals for program support for Sojourners Transitional Housing, Latah Recovery Center, Family Promise of the Palouse, various meal programs, and more. We in the League of Women Voters Moscow are glad that our study could help lay the groundwork for this outcome and provide helpful information for an array of public goods. We hope that it serves as an example to inspire others. We're honored to be included in today's celebration and delighted that the long, winding road that brought us here is at Latah Community Health. Thank you all.